all of you. Good afternoon. As you all know, the FDA and CDC announced earlier today that out of abundance of caution, they've recommended a pause in the use of Johnson&Johnson vaccine as they review data involving 6 reported U.S. cases of a rare and severe type of blood clot in individuals after receiving the Johnson&Johnson vaccine. Let me start by saying that this announcement will not have a significant impact on our vaccination program. The J&J vaccine makes up less than 5% of the more than 190 million recorded shots in arms in the United States to date. The president has always said that this is a wartime effort. We're at war against the virus. And as such, we've mobilized a wartime effort so that we're prepared for a wide range of scenarios. And that's why the president took action earlier this year, before the J&J vaccine was even authorized, to secure enough Pfizer and Moderna doses for 300 million Americans by the end of July. Over the last few weeks, we have made available more than 25 million doses of Pfizer and Moderna each and every week. In fact, this week, we will make available 28 million doses of these 2 vaccines. And as we've done since we took office, we will continue to get the supply out the door as soon as it's available. So we have more than enough supply of Pfizer and Moderna vaccines to continue the current pace of about 3 million shots per day. And that puts us well on pace to meet the president's goal of 200 million shots by his 100th day in office and continue to reach every adult who wants to get vaccinated. We're now working with our state and federal partners to get anyone scheduled for a J&J vaccine quickly rescheduled for a Pfizer or Moderna vaccine. And we're actually already seeing this happen today at sites across the country where J&J appointments are being adjusted that were for today to actually get Moderna and Pfizer today. So that's happening many places across the country. The president has committed to the American people that his administration will always lead with science, tell the truth, and give Americans the facts as we know them. CDC and FDA will continue to do just that and provide regular updates to the public, and they will do so as they continue their investigation. With that, let me hand it over to Dr. Fauci, and then we'll take questions. Oh, sorry, let me get my mask.
Thank you very much, Jeff. Just to follow up a bit and maybe fill in a couple of points from what Jeff said and what our colleagues in the FDA and the CDC said earlier this morning at the press conference. A couple of issues come up of the importance of calling this pause because people say, what does a pause mean? It really allows both the FDA and the CDC to further investigate these cases to try and understand some of the mechanisms of what it is, some more details about the history of the individuals who were involved that might shed some light on looking forward, what will happen and what we will do. That's the first thing. The other thing is to make physicians out there aware of this, and there are some clinical implications of that I believe are important. For example, if someone comes in with this really rather rare syndrome of thrombotic thrombocytopenia, where you get thromboses, and when you have thromboses, the most common way to treat that is with heparin. That would be a mistake in this situation because it could be dangerous and make the situation much worse. So there's a clinically relevant reason why you want to make this known to people. Also, when individuals, particularly younger women, who might come into a physician with a particular thrombotic phenomenon, which is things that happen for other reasons all the time, that we want to alert physicians to take a history of a recent vaccination. That would be important. So the pause not only allows us to take a look at the cases and learn more, but it is also a signal out there to help the physicians. Common question, and I'm sure we'll have a number of questions which Jeff and I will be happy to answer to you, but one of the questions that comes up already rather frequently, does this have anything to do with the efficacy of the vaccine? So we know that there have been 6.85 million doses of J&J distributed in the United States thus far. So someone who maybe had it a month or two ago would say, what does this mean for me? It really doesn't mean anything. You're okay, because if you look at the frame, the time frame, when this occurs, it's pretty tight, from a few days, 6 to 13 days from the time of the vaccination. The next question is one that we're all obviously aware of. What impact is this going to have about people's attitudes about vaccines in general? So you might know that there have been now 120 million people that have received at least one dose of a vaccine. Most of that, subtract the 6.85 million, is in the messenger RNA from Pfizer and from Moderna. There have been no red flag signals from those. So you're talking about tens and tens and tens of millions of people who've received vaccine with no adverse effect. This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million. So remember, this is something that we always, out of an abundance of caution, as Jeff said, to give us a time to take a good look at it and see if we can get further information. So I'll stop there, Jeff, and we could obviously take some questions.
Okay. Mary, you want to kick us off? You've described this as a really rare event, but this does seem like a pretty drastic step. Do you believe that the scientists sufficiently weighed the benefits of this pause against the damage or risk that this could do to the broader effort and the impact it could have on vaccine hesitancy?
Well, Dr. Fauci, maybe you'll go after me, but I want to say that we have plenty of supply. So I mentioned that we, for the last several weeks, have been sending 25 million doses out. And while we're averaging 3 million shots in arms per day, the 25 million supports actually that level and even accelerating. And we just sent out 28 million doses today, or announced 28 million doses will be sent this week to states, tribes, territories, and through our federal channels. So we have plenty of supply to continue our vaccination program and to hit our goals. But over to Dr. Fauci.
Yeah. I believe your question is, did we pull the trigger too soon on this because it was such a rare event? Well, you know, our FDA is internationally known for their capability of making sure that we have the safest products out there. And that's what I meant when I said an abundance of caution. You want to make sure that safety is the important issue here. We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can. And that's why you see the word pause. In other words, you want to hold off for a bit and very well may go back to that, maybe with some conditions or maybe not. But we want to leave that up to the FDA and the CDC to investigate this carefully. So I don't think it was pulling the trigger too quickly.
And just a logistical question more so than anything. The Advisory Committee on Immunization Practices is meeting tomorrow to discuss this. Why not try and meet today? I mean, is this not a moment to sort of drop everything and focus on this?
You know, I think you have to get people pulled together. I think tomorrow is not such a long wait. I mean, I'm sure they want to get everybody. There may be people who are not available. They want to get the full component of it.
Alex? Can you talk a little bit about the process in both deciding for this pause and sort of what comes next? First off, did the White House have any advance notice of the issues with the J&J vaccine, and was there involvement from the White House in deciding this? And how do you evaluate when to pause vaccines? Are we going to see more of these pauses in the future if more issues pop up?
Why don't you do the first part and I'll do the second part?
This decision was made by the CDC and the FDA. And that's one of the things that's, I think, such a good thing about our system here, is that we're ruled by the science, not by any other consideration. So the decision was really thoroughly made by the CDC and the FDA.
I'd say consistent with following the science, we were notified last night that there would be an announcement this morning, and therefore had no other involvement other than knowing last night that there would be an announcement this morning from the FDA and the CDC.
And in this review, what's going to happen? What are they looking for? What are they evaluating? When should we expect a conclusion?
Well, they want to see if there's any clues of other things going on. Were there any underlying, for example, if they're going to, just hypothetical, if they're going to make a decision to go forward and say, we looked at this, if they find some common denominators among the women who were involved that might be synergizing and essentially enabling this type of an adverse event, they may know that for those who don't have that, it may be much safer. There may be clues when you go down and really get granular about every single case. In addition, they want to look at what some of the mechanisms are. The mechanisms may give some insight as to what is going on.
And should we expect to potentially see further pauses in the future? I mean, could this keep happening with the vaccines because they're so new?
Well, if you look at the history of, take a look at what has gone on with the Moderna and the Pfizer, where you have, literally tens and tens and tens of millions. Watch this carefully. There have been no red flags. When you have a red flag of something that is as serious as thrombocytopenia, particularly when you have an individual, one of whom died, you take that seriously. So I don't think that minimal things that very likely have nothing at all to do with the vaccine, that we're going to pull the trigger so quickly as to keep stopping and stopping and stopping. I think this is an unusual occurrence of a serious adverse event that you want to make sure before you go forward, you investigate it thoroughly. And that's exactly what they're doing. They're pausing so that they can look at it more carefully.
Thank you. A couple for Dr. Fauci first. It's great to see you back at the podium, Dr. Fauci. Given that the impacted patients were all women between the ages of 18 and 48, should women under 50 be excluded from getting the J&J vaccine?
The question you're asking gets back to several of the questions here. That's the reason why the CDC and the FDA want to take a look at this and say, are there some categories now where people outside of that categories don't have any of the factors, so it'll be okay to go on? It is entirely conceivable, making no predictions, that there may be some restriction in an age group or not. We don't know that now. That's the reason why they're working very hard to answer the question you're asking.
And what's your medical advice for people who have recently received the J&J vaccine and may be concerned about blood clots?
Well, if someone recently, within days, I would tell them to just, first of all, don't get an anxiety reaction, because remember, it's less than 1 in a million. However, having said that, pay attention. Do you have symptoms? Headache? Do you have shortness of breath? Chest discomfort? Do you have anything that resembles a neurological syndrome? And obviously, if you have something as serious as a seizure, that's pretty clear. But the manifestations of this are that headache is the very common component of it, because the sinus thromboses that they have is the draining of the blood in the brain, and it will cause enough symptomatology to make you notice it. Just tell people to just watch out for not feeling very well.
And one for Jeff. Officials from different states told us this morning that they were really caught off guard by this announcement. They were ready to put shots into people's arms and had to scramble. Can you explain that chain of communication? When and how did you notify states that they might have to pause?
Right. Well, as I said, we didn't know about anything in terms of the announcement until last night, and we didn't even know the content of the announcement until this morning when everyone else read it. As soon as we got that, our team farmed out and started contacting folks to make sure that everyone knew that that was now announced by the FDA and CDC. Tuesday is the day that I have my regular governor's call, so that was fortunate that that was at 11 a.m. So we had all the governors already lined up with their teams, and we had Drs. Fauci and Drs. Walensky join that call, and the teams will continue to support the statewide efforts, the federal channels, the community health centers to make the adjustments. So I think the message got out very clearly and quickly, there was no heads up here. The announcement was made this morning.
Thank you.
Thanks, guys. Just two quick ones. The first one, and you might not have the answer to this, do we have a timeline in terms of how long this is going to, are we talking days before it might get flipped back on, or a week? And then second one for Jeff, if you don't mind, I understand what you're saying on the macro level related to supply, but when you talk to local officials, the J&J shop, because of storage, because it was one shot, was considered a crucial component in rural areas and kind of underserved communities. How does that not affect the timeline that you guys are on in terms of actually getting shots in arms?
During one of the questions which was asked, I believe, of the CDC, the question was just yours, and I don't know what they're going to be doing. What I heard from the previous press discussion was it's going to be more like days to weeks rather than weeks to months.
We have plenty of supply, and we have plenty of vehicles for delivering that supply, whether it's through the federal pharmacy channel, whether it's mobile units, community health centers, and all of those are equipped to deliver the Moderna and Pfizer vaccines. So we'll make sure that those units continue to grow in number, because you're right, we need to reach people where they are, and the mobile units and the community health centers are particularly essential for those. And they have been receiving Moderna and Pfizer doses since we began both those programs.
So it's no different, you just swap out the vaccine if it was a mass vaccination center or if it was a mobile unit going to a rural area?
Yeah, the Moderna and Pfizer vaccines, as you know, are 2-dose vaccines. Right. So it's important that people come back for their second dose, 3 weeks post their first dose of Pfizer and 4 weeks post their first dose of Moderna. But all of our units, all of our delivery channels are equipped to deliver both Pfizer and Moderna.
And just real quick, how does this not contribute to, those are the very areas where hesitancy, I think, is most predominant at this point in time based on what you guys have seen? Do you have to change your message? Do you have to do something different to address hesitancy in the wake of something like this?
No, I think we need to continue to be transparent about what the science is telling us. That's what brings us here today. There's, as Dr. Fauci said, there's been tens of millions of doses of Pfizer and Moderna administered over the last several months, and millions of people, both in the U.S. and around the world, have been safely vaccinated. I think it's important that we have here the FDA, and the FDA is the gold standard for ensuring the safety and the effectiveness of the vaccines. And today's action, I think, is clear evidence that they're taking every step necessary to ensure the American people have clear and transparent information about the safety and effectiveness of these vaccines. So the bottom line is the vaccines, Moderna and Pfizer, that are now being administered are clearly safe and are saving lives, and every American should get vaccinated when it's their turn.
Thanks, Jeff. Is J&J production going to continue during this pause? And secondly, is the Biden administration considering ordering more doses of Pfizer or Moderna, given, just in case this problem with J&J becomes prolonged?
So the J&J production issues in Baltimore are obviously a completely separate set of issues, and those are being worked out through the FDA process with the company. And production of those vaccines begin if and when the FDA authorizes that facility. Your second question was, we really have thought of this as a wartime effort from the beginning, which is why we purchased excess supply, so that we'd be ready for any contingency. And we'll continue to look at every possibility in terms of making sure that we always have enough supply for the American people.
Well, just to clarify on the J&J production, not related to the Baltimore plant, but just overall J&J production, is that going to pause while this pause on administering doses occurs, or is the production going to continue?
Well, the production is really centered around that Baltimore facility. The vast majority of the production is that Baltimore facility.
Andrew?
I just want to, Jeff or Dr. Fauci, I want to just ask you very directly, are you ruling out the possibility that the vaccine could be removed from the market? I mean, are you ruling out that, are you expecting it to be re-allowed?
I think it would be premature to comment on that, and that's the reason why the pause was done, so that they could take a good look at it very carefully, look at every different factor. I wouldn't want to speculate as to what would happen. Often, when you see things like this, that you pause and come back. Whether or not that happens now, I can't guarantee it, but I can tell you that's exactly what the CDC and FDA people are going to be deciding on and looking at very carefully.
If I could just ask you on this outreach question. So, this is a problem that you've been struggling with, the sort of vaccine hesitancy. This obviously is a setback. What do you have to sort of ramp up into an additional war type effort to really ensure that this message gets out there? Do you personally go to states like Mississippi where the vaccination rate is really low?
Well, let me answer your first question, and then I'll, we, consistent with it being a wartime effort, we've planned for different scenarios and different contingencies. So we have enough supply of Moderna and Pfizer to hit the targets that we've set, the 200 million shots in 100 days, and to head toward the 4th of July that we've talked about as a country, a more normal 4th of July. Clearly, part of that is making sure that when it's an American's turn to get vaccinated, they get vaccinated, and we do need to continue to build confidence, and that's done at the community level. People are trusting of their local doctors, their faith leaders, their neighbors, which is why it's important when people do get vaccinated, they not only get themselves vaccinated, but they spread the word about the safety and effectiveness of the vaccines.
Steve?
Just to nail it down, Jim, one of the goals that you haven't mentioned today is the hope that there'll be enough supply on hand for the country by the end of May. Is that still operative now in the wake of this pause? And the second question is, it's a bit surprising to learn that you only yourself learned about this morning. Do you wish you had heard sooner?
Yeah, I learned about it last night that there would be an announcement, not the specifics of the announcement. No, because that's to the science, and we want the science agencies to lead with science, and there's no reason for us to be involved in any of the scientific decisions. We bring nothing to the table. That is the FDA's role, that is the CDC's role, and they're led by terrific leaders with great teams to do the science, and this administration will be led by science. As to your first question, we believe there's enough vaccine in the system, Moderna and Pfizer, for all Americans who want to get vaccinated by May 31st to do so.
Yeah, Jeff, I feel like we're kind of dancing around the hesitancy question here, and so I'd just ask you directly, do you think the announcement of this pause will increase or decrease vaccine hesitancy?
Look, hesitancy amongst a group of people is a challenge, and we need to be addressing it, and we are, as I talked about, by going to meet people where they are, to follow all that we've learned about who people trust, their local doctor, their nurse, their faith leader. And I think that, there's tremendous track record, as Dr. Fauci has talked about, with tens of millions of doses of Pfizer and Moderna. The FDA, acting the way they did today, shows that they are indeed the gold standard, and I think that should reassure the American public that they will be very diligent and conservative in how they approach the vaccines.
So the argument is